Okay, today we're reviewing instrument ID 1. We're going to be taking a look at some of the more commonly used instruments in dentistry. Here we have our mouth mirror. The mouth mirror provides indirect vision, retraction to help retract the tongue or cheek, and it can also reflect light into the mouth. Next, we have the Shepherd's Hook Explorer. The Shepherd's Hook Explorer is used to examine teeth for decay, calculus, furcations, or other abnormalities. Next, we have the Pig's Tail Explorer. If you can see down there at the end, it kind of looks like a little pig's tail. It's a dual-ended instrument, and it is used also to examine teeth for decay, calculus, furcations, or other abnormalities, and it's really a matter of preference between the two. Next, we have the periodontal probe. You can see here, it's got small little increments there. It's marked in millimeters. So we use millimeters to measure the periodontal pocket depth, or the attachment level between the periodontium and the gingival attachment. Next, we have the cotton or dressing pliers, and they are used to grasp or transfer items into and out of the mouth. Here we have the spoon excavator. This is also a dual-ended instrument. It is used to remove carious dentin from the prep. Next, we have the cement spatula, used to spatulate cements, as the name implies. Next, we have the Di-Cal instrument or liner applicator, and it's used to place calcium hydroxide or glass ionomer into the cavity prep. Here we have the Howie or 110 pliers. It's used to remove and place arch wires, and also used to place and remove materials or transfer items into and out of the oral cavity. Here we have the condenser plugger. It's a dual-ended instrument as well. It can be, sometimes they have a smaller end on one end and a larger end on the other. Sometimes it's the same, it just depends. There's really all different varieties, but it is used to condense amalgam or other restorative materials into the dental prep. Here we have the football ball burnisher. It's a dual-ended instrument. At this end we have the football end. The other end we have the ball end. And it is used to burnish dental materials. It smooths and burnishes dental materials. Next is the T-ball burnisher, and it's also, as its name implies, a burnisher, so it's used to smooth and contour dental materials. Next we have the beaver tail burnisher. It's also used to smooth amalgam. It can be used to contour the matrix band and burnish materials. More commonly though, the football or ball burnisher is used to burnish the matrix band. And then we have the Ladmore burnisher. Looks very similar to the plugger or the condenser, but the ends here are a little smoother. The contour of the working end here is smoother, and because of that it is used to burnish. Next we have the carver. It's a discoid cleoid carver. This end here is the discoid end. It looks like a little disc. And down here we have the cleoid end, and it's a little more pointed. You can see that there. And it is a carver. It's used to carve the anatomy into the tooth structure, and this particular carver is used for carving the occlusal surface amalgam restorations. Here we have the Hollenbeck, And as you can see here, another dual-ended instrument. The end here is very narrow, and that is useful for carving interproximally. So the Hollenbeck's function is to carve interproximal restorations. Next, we have the composite instrument. As you can see here, the ends of the composite instruments are actually made of a different material. It's almost like Teflon. It's just resistant to sticking. So they come in all different shapes and sizes. This particular one is very similar to a plugger, a condenser or a plugger, and so it's called a composite instrument though because it's used with composite to help prevent that sticking. So it's a composite placement instrument. Next we have the H6, H7. You can see here is another dual-ended instrument. This instrument is actually a scaler, and it's often used in the operative setup to help remove any excess composite that may get stuck interproximally. Here we have the periodontal knives. We're not going to get into individual names. I just need you to know that they are the periodontal knives since they are used in periodontal surgery. We have our periodontal file, periodontal chisel, we have our articulating forceps and articulating paper, and the articulating paper is used to test occlusion. So after the dentist has completed the restoration, they will have the patient bite on the articulating paper, and it marks areas that are hitting that may be elevated or higher. So if you're able to articulate the two arches there, they're able to come together and make a mark on the restoration, you know that the restoration is probably just a little too high, and that's how the dentist knows where to remove excess material. Here we have the anesthetic syringe, and it's used to give local anesthetic. Here we have the needle holder. It's actually a control device to help prevent needle sticks. So the needle is placed inside, just like that, and then you would have your syringe. Once it's all set up, it would be placed just like that, and it helps to keep the needle cap in place, and so when you are recapping a needle, you would recap it into that control device to prevent needle sticks. Okay, next we have our needles. I'll get this one out of the protective device. Okay, we have our size, it's a 27 gauge here. It's a long needle. The 27 gauge needle is used to give block anesthetic and is primarily used on the mandibular arch. Here we have a 30 gauge needle or a short needle, and it is used to give maxillary infiltration injections. So it's used on the maxillary arch. Next we have our anesthetic carpule, and that is anesthetic placed into the, goes into the aspirating syringe. Our topical anesthetic, and it is used to help numb the tissue where the injection site is. Number 28 is our cotton tip applicator, so we use that and place into the anesthetic, the topical anesthetic. 29 is our 2x2 gauze. 30 is our air water syringe tip. 31 is amalgam well. Here we have our amalgam carrier, and you would use these two together. So you would use the amalgam carrier to pack and condense amalgam into the carrier, The carrier would then be loaded and used to transfer amalgam to the dentist to place into the dental prep. And then we have a dental capsule. This is where the dental material, the actual amalgam is inside this capsule. So it's separated by a little barrier. So one end has a little bit of mercury, the other end has the metal alloy. And here we have our amalgamator, and the amalgamator is used to mix the amalgam. It can also be used to mix dental cements as well, glass ionomer. I'm trying to do this single-handedly, so forgive me here. But you would place it inside here, you would turn it on. Usually it's on setting 7 to 8 for amalgam. And so it mixes it or triturates it for 7 to 8 seconds, and it breaks that little fine barrier between the mercury and the amalgam alloy, and it makes the amalgam condensable, where you're able to place it into a prep tooth.